Good morning, everyone. My name is Sana Khan, and today I will present my literature on selected population adults with autism. But before that, I would like to acknowledge the country. Victoria University acknowledges, recognizes, and respects the ancestors, elders, and family of the Bunurong, Bunburong, Patawurong, and Wurundjeri, Woiwurrung of the Kulin, who are the traditional owners of university land in Victoria, the Gadigal and Gurigai of the Eora Nation, who are the traditional owners of university land in Sydney, and the Turrbal people living in Manitchin. This presentation examines trauma's impact on autistic individuals. Autistic adults with PTSD represent as vulnerable populations. They struggle to articulate their needs or recognize potential threats which can exacerbate existing traumas. We will examine how autistic child's elevated trauma risk creates long life impacts, manifesting adulthood through emotional dysregulation and social difficulties and heightened sensory sensitivity. We discuss the barriers to trauma informed recovery oriented care and challenges faced by clients and professionals. We will review evidence based practices supporting effective diagnosis, treatment, and recovery outcomes. We will talk about essential policies, reforms, and professional training requirements to enhance trauma informed care delivery. In the roadmap, we will cover our population, which is adults with autism, understanding the impact of trauma in adults with autism, challenges diagnosis, various recovery oriented practices, evidence based practices, importance provided practices are, and conclusion. Now, the symptoms of autism and PTSD often overlap, which can lead to underdiagnosis and insufficient treatment. Characteristics between autism and trauma responses, such as sensory sensitivities, emotional dysregulation, and social withdrawals. It is of utmost importance to examine the interrelatedness between the PTSD and autistic symptoms. This calls for an empathic and holistic approach in the care delivery. Providers must have empathy as a major trait and must cultivate rapport and trust to show an understanding of awareness of individuals' lived experiences to help them feel safe and understood. Now, there are several challenges to implement recovery oriented practices, but let's focus on few over here. Number one is independence and empowerment. It is vital that individuals feel respected, comfortable, at ease when discussing their traumas with their healthcare providers. Creating a safe space empowers them to feel, to express themselves freely. Like Perry J. Fells, Care M et al. 2014 also says that people with intellectual disability and autism can make choices about their everyday life, yet decisions about their healthcare may be made by their carers, their family, or healthcare providers. Flynn S. Hulbert Williams, N.J. Hulbert Williams L. et al. 2016 also says that they feel empowered when they are involved in in the decision-making progress and gain a better understanding of their treatment and diagnosis. Let's talk about building trust. It is important to build trust with the individuals on autism spectrum, as they may find it difficult to trust others. Building trust can help practitioners and staff members to implement appropriate strategies when creating a plan for their trauma recovery. Simonge et al. 2015, Huntington et al. 2005, and Mentler et al. 2018 all noted that the implementation of the TIC in other agencies servicing their client was important to implementation success in their own organization. This is when where the clients receive TIC services from their organization. This was undermined by other agencies, delivering care that reduced client trust and sense of safety with healthcare providers. The next is time. Time is vital for individuals with trauma. Long waiting times can cause frustration and anxieties. It's important to maximize the time spent with the practitioner as poor communication and missed information can lead to ineffective treatment and increased stress for the client. Prolonged times waiting to be seen, limited time spent with the healthcare practitioner during an appointment act as barrier. Long waiting times are a major case of the anxiety and stress. Now let's talk about evidence-based practices to support trauma-informed recovery-oriented care. The recommendations for organizational culture are building a trauma-informed workforce, a supportive culture that prioritizes staff health and safety, enhances counselors' ability to deliver trauma-informed behavioral health services. Administration should focus on strengthening the workforce to promote overall culture of care. Hogan in 2007 also says requires creating environments that support the health and well-being not only of persons with the mental and substance use conditions but of the workforce as well. The next we will talk about recommendation is leadership commitment. The safety of the employees and the clients need to be guaranteed by the trauma leadership. They offer consolation and ensure that no one is being judged. The leaders actively collaborate with the employees to ensure that their trauma does not affect their mental health as well. Many authors like Shanna Tay, Troquel M., Rodriguez A., Logan D. 2021 also said trauma-informed leaders share key qualities such as authentic warmth and no judgmentalism. They take necessary steps to promote physical and psychological safety and create a culture of wellness in their work ecosystem, which has been proposed to move organization from burnout to resilience. Policy and procedure recommendation practices. One recommendation is revisiting the policies. Review and modify agency policies and procedures to ensure a focus on trauma, providing guidelines to support the delivery of trauma-informed services and a commitment to reduce re-traumatization, ensuring their safety and confidentiality. Sharing best practices can guide agencies and minimize barriers. The second communication is language communication. Words matter. Language should move away from a victimizing, deficit based approach, for example, using what happened to you and not what's wrong with you. Language should be respectful, positive, grounding, non judgmental, clear, strength based, and carry sense of commitment. The same should be practiced in the non-verbal cues and body language as it all contributes to recovery and response. Communication methods vary individually and cross-culturally. It is important to provide culturally appropriate and accessible forms of communication. This may include in the use of interpreters as well. The third one is including diverse people in the policy. Taking a diverse individuals approach is the need of the hour. Equitable care requires revising all policies and procedures to respect diversity of culture, gender, sexuality, ethnicities, religion, age, ability, socioeconomic positions, and experience. Policies and projects should comply co-design principles, working in collaboration with people with lived experience of trauma caused by racism and racial discrimination. This can improve both policy and relevance and service responsiveness. Let's talk about last evidence recommendations, which is professional practice training recommended. Manchester C. Mall A 2016 also said trauma presents uniquely in autistic adults, requiring specialized clinical expertise. Staff require training to distinguish autism related behaviors and trauma responses and recognize trauma effects on sensory processing, communication, repetitive behavior, and emotional dysregulations. Training staff about psychological trauma is also an essential step in the delivery of trauma-informed care, particularly in health setting where the mental health is not the primary focus of their treatment. The next one is professional development. Challenge poor practice in ways that promote the use of evidence-based, legally and ethically sound practice to safeguard individual and enhance their well-being. Appreciate and utilize the lived experience of autistic people and their families and carers in one's own personal development. Undertake personal development based on the changing needs of the individual using the service to ensure that the service provided meet those needs. The source has been taken by Autism Capabilities Framework, October 2019. Now, why these recommendations are important? They are important because autistic adults with PTSD require specialized trauma-informed care that needs to address their complex, intersecting needs. Key barriers include limited assessment time, trust building challenges, and misinterpretation of trauma-related behaviors as autism symptoms. Proper training enables staff to communicate clearly and supportively with autistic clients, explaining trauma in accessible ways while reducing anxiety and communication barriers. Effective training addresses sensory sensitivities and emotional regulation challenges specific to autism. Evidence-based protocols create safer environment and enables team to focus on meaningful recovery outcomes from autistic individuals with PTSD. Client engagement through respectful communication and participatory care planning builds trust, creates shared ownership, and enhances the long-term treatment outcomes. Let's conclude what we have talked about early. Autistic adults with PTSD require specialized, trauma-informed care that address their complex intersecting needs. Key barriers include limited assessment times, trust building challenges, and misinterpretation of trauma-related behaviors as autism symptoms. Effective intervention requires practitioners to build strong therapeutic relationships using non-re-traumatizing communication strategies. Organizations must develop tailored policies, invest in specialized staff training, and implement system-wide changes that promote coordinated care. Success hinges on creating recovery-focused environments that combine clinical expertise with compassion, ensuring autistic adults with PTSD receive the respectful, effective support they deserve. Thank you so much, everyone.